Hello.
My name is Julie. I'm going to be your nurse today. I close the curtains and perform hand hygiene. How are you today?
Good.
Okay. Before I go on, can I please have you verify your name and date of birth?
Rapunzel Hernandez, November 23rd, 1995.
Okay, and that matches my MAR. Mrs. Rapunzel, do you have any allergies I should be aware of?
No.
Okay. The reason I'm here is to perform a dressing change. Have you ever had any trouble with your central line in regards any itchiness or any fever in the last 2 weeks? Any redness in the site?
No.
Okay, very good. I'm going to swap that dressing, and before I do that, I'm going to remove the old one, and I will give you a mask to protect the sterility of the field that I'm going to create underneath your catheter, okay? Are you okay with me doing that?
Mm-hmm.
Okay. And I'm going to remove the old dressing, pulling towards insertion site, not against it. I already inspected the area and there's no redness. This might hurt a little, I apologize. And I'm gonna hold the catheter in place while I work around the edges. Once the adhesive is almost completely removed, I can gently pull towards insertion site. I'll remove the bio patch as well. And I don't see any signs of margin of migration. And then I would put it normally to the side to avoid contaminating my sterile field. Okay, I'll gather my supplies. Okay, Ms. Rapunzel, you're gonna wear this mask for me, please? Are you at a comfortable position? Okay. How do you like the weather now?
Good.
Good. I agree. We need more days like this in Arizona. And I am careful not to touch the middle of the sterile bag. Pull this carefully. And I previously cleaned my area. I am careful when dropping my bio patch in the sterile package. Trying to scoop this inwards, like so. Put on my mask. Then I start working in the sterile gloves. Put this fenestrated drape under you. Shiny side up, folding it under my sterile gloves. Be careful now not to touch the dirty catheter. I grab the ChloraPrep and pop the contents of Chlorexity. Then I start cleaning in a back and forth motion, like so, for 1 minute. I can grab my gauze to secure the catheter. I do this back and forth vigorously. 1 second, baby. Okay, and towards the catheter, I use the edges of the sponge going outward, avoiding to touch with the dirty side already used. Then once this is sterile, I can drop it in my sterile field without contaminating. I apply the bio patch. Like so. Then I swap your dressing. I'll be right there. And normally I would have a dressing according to the patient. This one might be a little bigger, but for practice purposes would work. I can remove the sterile field now since I'm done with sterility. I make sure that it protects all the area I've sanitized and cleaned. Make sure I take up the adhesive remaining. And in a normal patient, this would stick better. I just gotta make sure I do it carefully, not enough to pull and ruin my patch. Okay, I put my initials, and at this point I should be done with sterility. This is trash. I'm coming, hold on. And I apologize in advance for the background. I will be putting the date my initials and the size of the catheter to indicate that there's no migration from site. Put this label now, the new dressing. Okay, Mrs. Rapunzel, how did I do? How you feel?
Good.
Okay, we're all set now. I'm going to perform some hand hygiene and make some notes of the new dressing and how the insertion and the catheter look, okay?
Okay.
I'll be back to check up on you.
Okay.